Hey there, this is Dr. Evan Osar, developer of the Integrative Movement System. Welcome to this three-part video series of Integrative Movement Insider, training the older client. In this three-part video series of Integrative Movement Insider, we're going to discuss how we work with our clients, especially how we improve hip function and thereby reduce stress to our clients' low back and or knees. If you work with older clients like we do, and if you're watching this video, you probably do, you know that there's a lot of talk around clients that are in anterior versus posterior pelvic tilt position. Most of our population today is not in anterior pelvic tilt, despite what we learn oftentimes in our industry and through a lot of the workshops and articles that we read. I first learned about this concept back in chiropractic school 19 years ago, that we learned that everybody essentially in the modern day world is in anterior pelvic tilt. However, we don't see that anymore. In fact, I rarely see somebody in my clinic, in my patient population, and even the athletes that we look at, that is in true excessive anterior pelvic tilt. To the contrary, most of our clients are more posterior pelvic tilted. So why would that be? Why have so many of our clients taking their pelvis from where ideal neutral is, somewhere around neutral where they're slightly anterior tilted, and move themselves into posterior pelvic tilt? A couple of reasons why. Number one, the majority of our population sits for a living, and they sit from the time they are young, in school, to play on their computers, to play video games, and then they go to jobs and sit. That positions them in a posterior pelvic tilt. They don't necessarily get out of that position when they start to stand and or move. Many of our clients have also been taught to over-clench and over-grip their posterior hip complex, so their glutes, their rotators, and even their hamstrings. So that will pull them also into a posterior pelvic tilted position. So here's how this relates to so many of our older clients, because now our older clients are coming to us and they're already moving into, or they're in that posterior pelvic tilted position. There's one additional reason some of our older clients are in that position, and that's this condition called spinal stenosis, or when there's a narrowing of the spinal canal and or nerve root canal where the nerves come out of the low back and down the leg. Posterior pelvic tilt is a position that allows them to reduce stress and strain, some of that neural tension that can happen when there's too small an opening because of degeneration, because of thickening of ligaments, because of scar tissue and other tissue that starts to build up inside and in between the nerve roots and the spinal canal. So we don't want to necessarily force our clients out of posterior pelvic tilted position. However, when we're training our clients that have low back, hip, and even knee dysfunction, we need them to be able to move their pelvis over top their femoral head to create the optimal hip hinge. So here's essentially what we want them to do. And you understand this, I just want to demonstrate it just so you understand what we're going to do in the next two videos. We want them, when they're doing any kind of loading pattern, we want them to be able to move that pelvis over top their femoral head, so that they're actually creating anterior pelvic tilt or anterior pelvic rotation of the pelvis over top the femoral head, so that they can appropriately hinge from their hips, so that they can appropriately hinge and squat, hinge and deadlift, hinge and bend forward. That's so important because so many of our clients, especially those older clients, they're stuck in posterior pelvic tilt. So as soon as they start moving, they go further into posterior pelvic tilt. And that's ultimately what continues to stress their low back. So in the next couple videos, I'll share with you the common patterns we use with our older clients to help them improve their ability to get the pelvis to move anteriorly. We don't want them in an anterior tilted position. We want them to be able to move their pelvis anteriorly over top their femoral heads, because that's ultimately what allows them to load their glutes, because most of our clients don't have weak glutes or amnesic glutes. What they have is an inability to get their pelvis to rotate over top the femoral head and to load their glutes and their posterior hip complex appropriately. And oftentimes, especially in those athletes that we see, and this is not about athletes, but I'll just mention it, they've worked so hard on gripping their posterior hips, so the glute max, the posterior fibers of glute medius, the hip rotators, that they don't have a good ability to sit back or hinge their hips, and therefore a lot of their motion when they squat, lunge, deadlift, bend forward is coming from their low back. So in part two, I'll share with you how we start that process. And of course, You'll do your soft tissue, your manual work, your trigger point release, anything that you do to help your client release that tension first prior to moving into the patterns I'll demonstrate in the next 2 videos. So this is Dr. Evan Osar with Integrative Movement Insider, helping you discover the strategies to help your older clients do the things they need to, want to, and love to do. Take care, thanks for watching, and I'll catch you in part 2.